Great. Thank you all so much for joining for our first Telehealth Working Group meeting of 2026. We've got a number of items on the agenda to review and talk about together. First being the next waiver expiration date that is coming up in just a few weeks. And then an update on some of the prescribing waivers and some of the activity on that over the past few weeks. An update on some of our tracking of legislation at the state level surrounding collaborative practice agreement requirements. An overview of a recent health IT proposed rule from HHS. And then, of course, our regular member discussion and review of upcoming events. So, as you may recall, back in November, a continuing resolution to end the government shutdown included an extender of the Medicare telehealth reimbursement expansion waivers. And these were extended to January 30th of this year, which is just in a few weeks. That continuing resolution only provided full year funding for only a handful of the 12 appropriations bills that are needed to fund the government, whereas the rest are also going through this January 30th date. There has been movement on some of the appropriations bills since November, over the course of December, and really picking up over the past few weeks. Just last week, three more bills, Commerce, Justice, Science, were passed in the House in a 397 to 28 vote, as well as some movement on financial services, national security, State Department, and Homeland Security bills as well. The three most likely to run into trouble getting through Congress are Defense, Health and Human Services, Homeland Security, Labor, and Education. There's still progress that is going on with these. However, we have not seen any draft legislation or text on these yet. And so if only some of these bills pass and the rest are not passed by the January 30th date, Congress then finds itself either needing to pass another short-term continuing resolution, or the government will enter a partial shutdown. And of course, if Congress does not act on the Medicare telehealth waivers, either by extending the waivers or passing legislation to make them permanent, these will also, again, be at risk of expiring as well. Any questions on the status of appropriations or the telehealth waivers for Medicare? And of course, the other big waiver that's been on the top of our minds for the past few years is telehealth prescribing of controlled medications. The DEA had signaled that it was going to issue its 1 year extension back in November. However, as we got closer to the December 31st deadline, there was no movement on this or the publication of the final extension. So CTeL was in contact with our contacts at DEA and HHS to ensure that this waiver extension would go through and that there would be no risk to continuity of care for any patients who are covered by these extensions. It's also important to note that there were two final rules that were issued last year, one concerning buprenorphine prescribing and the other for prescribers within the VA. These rules are still finalized. However, the DEA has indicated that those who would also have been covered by these final rules can also still be covered under these waivers, as the waivers are more permissive than what these two rules would provide for upon waiver expiration. And of course, we still have yet to see a special registration, either proposed or final rule from this administration, to provide for a long-term policy solution beyond these waivers. And so CTeL will continue our efforts to educate the DEA and HHS on this issue, as well as engage with Congress and continue to promote our research on this matter, which was published last year. Any questions on this? I also wanted to highlight one issue that CTeL is tracking for our members, and that is collaborative practice agreement requirements, which allow certain clinicians to engage in certain practice under the supervision of a physician or under a collaborative practice agreement. And we are also in the process of updating our 50-state legal survey on this. However, we have been tracking some efforts in a handful of states to modify these requirements. And so in Indiana, there have been bills introduced in both the House and Senate to remove collaborative practice agreement requirements for APRNs. There's also a bill introduced in New York to allow dental hygienists to work without supervision under collaborative practice agreements, as well as the Wisconsin Physical Therapy Examining Board proposing to allow PTAs to conduct assessments and reevaluations via telehealth. And so most of these are either proposed or just introduced legislation. As these and other bills move through, we will continue to update the community on this as well. And we'll also make sure to get out our updated 50-state legal survey for your use as well. Any questions here? Another issue I wanted to highlight for the community that does concern telehealth is the HTI-5 proposed rule, which is a pretty significant overhaul of health IT regulations from HHS. This isn't directly telehealth related. However, we do want to highlight these given the close integration of health IT with other digital health applications like telehealth. And so in this proposed rule, as is consistent with other regulatory actions from the administration, HHS is seeking to deregulate a lot of areas of health IT, one of which is its certification criteria, where it is proposing to remove 34 of its criteria and revise another 7. There is also a number of revisions to their information blocking regulations, which we'll talk a little bit more in depth later, as well as withdrawing a number of unfinalized proposals from the previous administration. There's a couple of points in this rule on specifically for AI and agentic AI agents and how they want them to be able to access certain health information. And so we will be preparing comments on that specifically and any other items that may be of interest to the CTeL community. And we'll be discussing that at our AI working group meeting next week as well, which you are all welcome to join. And so these are, this is the list of all the certification criteria that HHS is proposing to either remove or revise. And then I wanted to go a little bit deeper on some of the information blocking proposals, especially given that there has been an increased focus on access, use, and interoperability of health information. These are, of course, again, given the integration of health IT, health information, and telehealth, we wanted to make sure that these proposals are highlighted for you all as well. And so one proposal is that an update to the agency's definition of interference when it comes to information blocking. And according to a new FAQ that was issued by HHS, they're saying that the interference with the access, exchange, or use of health information by automation technologies, which is calling robotic process automation or agentic artificial intelligence, could implicate the information blocking regulations. And so again, this is HHS saying that they do not want to see actors getting in the way of artificial intelligence or agentic tools in the access of health information. There's also a proposed revision to the manner exception to exclude contracts, agreements, or licenses not at market rate, contracts of adhesion, or unconscionable terms. A modification to the infeasibility exception, which it proposes to either revise or remove entirely, and then a proposal to entirely remove the TEFCA manner exception, which of course in this rule, the administration has indicated that it wants to continue promoting TEFCA. However, it does not feel that this exception is necessary. The info blocking in particular is a bit of a more technical topic, especially for health IT. And so CTeL has a number of resources that are available to members on this. The QR code on the screen will take you to a presentation that CTeL held with Brad Rostalski from the law firm Greenberg Traurig, talking a little bit about information blocking and what those in the digital health community need to know about it. We also have a fact sheet that is available on through your CTeL member portal in the research library that goes over what information blocking is, how it's determined, and what potential impacts could be had if you are found engaging in information blocking. And so all these materials are available on your CTeL member portal, and you can access the webinar through the QR code on the screen. Any questions on info blocking, CTeL resources on that, or the HTI-5 proposed rule? And so that's all the main content and updates for this month. However, I wanted to open up to the floor to see if there were any issues that we did not discuss that you'd like to talk a little bit about, or if you have any updates from your practice or state that might be relevant for other members as well.
Lydia, this is Michelle Hager. On the info blocking, have they, and I don't know if you can go back to the document, not on that one, but the prior one, sorry, on the uses. Yeah, thank you. So for the manner exception, can you elaborate? Because historically, this info blocking has really been targeted at Epic. And I'm not sure can you elaborate on those terms? What does that mean, manner exception?
Sure. I can also pull up HHS has a kind of an overview of all the information blocking. I think there's 14 or so exceptions um, to these rules. Um, I can put a link to the link in the chat and also bring it up um, to share as well. Um, But with all of these revisions, the administration has more or less given the same justification for these, um, in that they believe that the exceptions as they currently stand unnecessarily get in the way of the exchange of health information. Um, and so that's why they are proposing these. Um, And so with specifically the manner exception, it will not be information blocking for an actor to limit the content of its response to a request to access exchange, or use EHI, or the manner in which it fulfills a request to access, exchange, or use EHI, provided certain conditions are met. And then it talks a little bit more in detail here.
Oh, okay.
But it's basically saying that if the way in which an actor fulfills a request for information, if they're not able to do so in the manner that it is requested, that they can then claim an exception and not be applied to the info blocking rules.
All right. And that to me just is the get out of jail free card for exactly the things that people have been worried about at the EHR level, the expense of an interface, for example, and et cetera. So, and thanks for including the link, Mark.
Um, yeah, I saw something today also in I think it was in Becker's. I put the link in here, sort of related to what you're saying, where there's sort of an abuse of the ability to access the data, depending on who you believe in the article, but I threw it in there as one of the risks that has surfaced.
Yeah, I think that's the same article that Mark
Oh
just.
yeah.
Yep,
Yeah, it is. It is. Okay.
yep.
Yeah. Funny, I had just gotten done reading that right before Mark. Great minds think alike. I
Exactly.
posted it, but then I realized I sent it to only one person for some reason.
Yep.
Yeah, and that's also something that HHS is citing, saying that we are concerned that some actors may be attempting to abuse the exception and that all participants in the health information ecosystem would benefit from greater certainty. And I can include a link that'll go directly to this part of the rule as well if you'd like to read through.
Is I find it interesting that Epic and Ochin are which is essentially a customer of Epic's, are the ones that are, headlining and UMass, who's headlining that case. They obviously want the exception.
Mhm.
Any other questions on some of the info blocking or HTI proposed policies? Any other content we discussed today or anything we didn't discuss yet?
Sorry, I'm going to ask a follow-on TEFCA as well. What does that mean, remove the exception?
Yeah, and so the TEFCA the TEFCA exception, um, I believe applied. I can here we go. Applied to two actors who are both participants of TEFCA. Um, and that an actor's practice of limiting the manner in which it fulfills a request for access, exchange, or use of EHI only via TEFCA would not be considered information blocking when the practice follows certain conditions. Of course, being that they're both part of TEFCA, um, and that the request is not made via certain standards. Um, and so the administration is proposing to entirely remove this exception, um, because while it was originally intended to incentivize participation in TEFCA, um, however, they don't believe that it is an adequate incentive moving forward. And I'll put a link
Interesting.
to this provision as well.
Interesting. Okay, thank you. To Mark's comment, not the best day for interoperability or the HIEs.
Any other questions or comments here before we look forward to future events? And of course, if anything comes up between the working group meetings, you're always welcome to reach out to us via email and or set up some time to meet as well. In terms of upcoming events, we've got a few big things coming over the course of the year. Um, our most closest upcoming event is a webinar we are planning for later this month to talk a little bit about some of the new legal considerations for audio only and asynchronous care, talking about some of our findings from our most recent 50-state survey legal research report, as well as what the implications are for practices in 2026 and moving forward. We're also planning a series of small room policy roundtables in DC, one per quarter over the coming year. Our current topics that we have planned include looking at reproductive telehealth and virtual care, AI cybersecurity and protecting patient data in a virtual care environment, mental health and DEA waivers, planning for the next cliff at the end of 2026, as well as understanding the fallout of RPM fraud investigations that we've been seeing over the past year as well. And then in June of this year, we are planning a digital health market symposium in New York City to look at some of the top issues facing digital health from a financial standpoint. This was based off some of the interest that we've seen over the past year in our engagement with those who are particularly interested in this area. And so we'll be continuing providing a forum for that as well as our Digital Health Summit large event coming up in October of this year, which Krista can talk a little bit more about as well.
Hi, everyone. Thanks so much. CTeL, Lydia did a fantastic job on this telehealth working group as usual, but just to give you a little bit more context in terms of our upcoming events, CTeL is really going back to its roots and having conversations um, in a more of a roundtable environment targeted to issue-specific areas. Our roundtables are listed Q1 through 4. The goal of this is, and this is not comprehensive, these are just the main ones that we're highlighting right now. We have a total of 7 that will be here. We're just waiting on confirmation from the last 3. And you're more than welcome to come in person. Also, very much welcome to join. I'm sorry, you're welcome to come in person. You're very much also able to join us virtually if you have interest in doing that. And the goal for each of these is to have a workable product at the end. So just like we did for DEA, CTeL held a roundtable, and then the result of that was actually producing published research in the Journal of Internal Medicine. And we're hoping to have conversations that result in a deliverable that will help inform policy or even change it, since there's so many laws and regulations that are on the brink of the cliff right now. In terms of the New York event, this is really exciting. And not many people know that for the last 12 years, CTeL has been heavily engaged in the investor community. We've done a lot of due diligence for big PE firms and VC firms. We are hosting, in conjunction with some of our investor relationships in New York City, to have a small 20 to 25 person roundtable discussion about, where really is like the market trending as it applies to AI, and what are these like main policy drivers that are impacting digital health, and like where should you invest your dollars, where should you not? And so that's going to take place in June, and in October we are doing a massive event. This is going to begin with a black tie ball that is going to be hosted in downtown DC, then followed by a summit that will take place on Capitol Hill, and then ending with a policy day, advocating for policy change on a series of policy issues. So you probably do note that we do not have the June or December event that is listed here. That is very intentional, because we've heard from our membership that there's more of an interest in having like one big event and these like kind of smaller micro conversations. So we're trying it out for this year. Excited to hear about everyone's feedback, but you're not going to have less engagement. You'll actually have more. And for all of you that are interested in joining us in October, dust off your tuxes, get your ball gowns ready, because it'll be something that the telehealth community hasn't experienced before.
Exciting stuff. Thank you, Chris.
Any feedback about the changes to the upcoming events agenda?
Chris, do you have dates for the October summit yet? Exact.
Yes, and I will get those to you. We're just finalizing
Okay.
details with our contract, so I just want to make sure that everything is good to go there before I announce it.
Sounds good. Thanks.
Yes, of course, Toby. And so if anyone is curious as to the content that we will be driving at the Digital Summit, is this issue of, telehealth is available to so many markets. So is remote patient monitoring, so is AI. But what is everything? What is everything like basically hinge on? And that is access to connectivity to the internet. And most patients receive access to the internet through their cellular data. And more of that cellular data is being utilized by all sorts of different means, but also like AI overlays that are kind of sucking up most of that data. What CTeL is going to be advocating for is advancing zeroing out healthcare data that is being used on cellular phone plans. And initially, like that's our main goal, but initially we'd like to at least get the ACP program reauthorized, giving access to cell phones and data plans to those that fall below the socioeconomic line. So that's our main goal. We are the front-facing group that is going to really be helping us here as the military, because 50% of active duty military men and women are stationed in HIPSA shortage areas. There's a big myth that they get access to healthcare on base. That's actually not true. There usually is no base healthcare. And shockingly, and kind of just shockingly and like heartbreakingly, 23% of military families are actually dependent on ACP phones, which are subsidized phones, because they fall below the socioeconomic poverty line. So this is something that we believe there's like a lot of support for the military community, and they're going to be front facing on this policy effort. But ultimately, this will have a larger impact on all sorts of different patient populations, from unhoused to military to everybody in between. Any questions there? Oh, I guess we have 7 questions. I just didn't see them. I apologize. Okay. I guess I was a little delayed in looking at my questions, but none are related to this topic. Well, we will look forward to seeing you all. And if you have any feedback or insights, or you would like to buy a table for this event, let us know, and we'd be happy to talk to you.
Thank you, Krista. Thank you, Lydia.
Thank
Thanks,
you.
Mark. Take care.
Thank you.